Ever look in the mirror and think, my gums are looking a little off?
Mm-hmm.
Well, today we're doing a deep dive on something that's actually pretty common: swollen gums.
Yeah,
We're going to get into why it happens, bust some myths, and give you the knowledge to take control of your oral health. And believe me, this is about way more than just a nice smile.
oh, absolutely.
What's going on in your mouth can actually be like a warning sign for your overall health.
It's true, yeah.
Luckily, we have expert speaker back with us to break it all down.
I'm happy to be back.
So let's say I'm brushing, flossing, the whole 9 yards, but then one morning, bam, I see a little swelling. What's the first thing I should think of?
Well, first of all, good for you for being on top of your oral hygiene. A lot of people ignore those early signs. Now, that single swollen gum could be a couple of things. Could just be a minor irritation, or it could be pointing to something a bit more serious like gingivitis, a tooth abscess, even a side effect of some medications.
See, this is what I love about these deep dives. It's like peeling back the layers of a mystery?
It really is.
So let's start with the basics. We hear about gum disease all the time, but what is the actual difference between gingivitis and periodontitis?
Okay, so that's a great question. Think of gingivitis like that warning light on your car's dashboard.
Yeah.
It's telling you something's up, right?
Right.
It's the earliest stage of gum disease. You'll usually notice some redness, maybe swelling in your gums. But the good news is, if you have good oral hygiene, gingivitis is usually reversible.
So if I like really up my brushing and flossing game, I can avoid that whole thing.
Exactly. But here's where things get a little, well, scary. If you leave gingivitis untreated, it can actually turn into periodontitis. Yeah,
Oh.
and that's a whole other story. We're talking potential bone loss around your teeth. And that's when you're at a much higher risk for, losing teeth.
Okay, that is definitely motivation to take care of my gums.
Right.
You also mentioned a tooth abscess, though. What exactly is that, and how is it different from gum disease?
So a tooth abscess is basically an infection inside of your tooth, kind of like a little pocket of pus. And it can be really, really painful, but sometimes it's not so obvious.
Oh, really?
Yeah, you might notice a salty taste or just really bad breath, even some swelling in your jaw.
Wait, so it's not always that, like, throbbing toothache feeling?
Not always, no. And that's why it's so important to, pay attention to any changes in your mouth. You know your body best. If something feels off, it probably is. Now, going back to your original question about just one swollen gum being a problem, here's something most people don't realize. Over 47% of adults over 30 have some form of gum disease.
Whoa, wait, really? That's like
Oh,
almost half the people listening right now.
it is.
That's way more common than I thought.
It really is, and that's why we're talking about it. Now, to get back to that one swollen gum you were talking about,
Yeah.
here's something most people don't realize. Even if you're doing everything right, brushing, flossing, all that,
Yeah.
there are other things that can affect your gums.
What else is there besides, not brushing?
Well, for one, medications,
Really?
hormonal changes, even smoking can have a big impact.
Huh. It's funny how we like think of our mouths as separate from the rest of our bodies, but it's all connected, right?
100%.
It's like our mouths are sending us these little messages and we just need to learn how to, understand them.
Yeah, it's like a whole communication system we don't even think about.
So let's decode those messages. Let's start with medications. How can those affect our gums?
Well, think of it this way. Your mouth is like its own little ecosystem, right?
Okay.
You've got all this bacteria, some good, some bad.
Right.
And just like any ecosystem, you need a balance. Medications, they can mess with that balance.
How sad.
For example, certain meds can actually reduce your saliva flow.
Oh, that's no good.
And you need saliva, right?
Yeah.
It's not just for swallowing. It's your mouth's first line of defense. It washes away food, neutralizes acids that can damage your teeth and gums.
Yeah.
Less saliva.
Well, it's like you're giving the bad guys a head start.
Exactly. You're basically rolling out the red carpet for all that nasty bacteria.
Oh, I don't like that visual.
Yeah, it's not pretty.
Okay, so medications can dry us out, which is never fun. But what about hormonal changes? Those can really mess with you, but what do they do to our gums?
Hormones, they're huge for gum health. Think about pregnancy, for example.
Okay.
All those hormonal changes, they can make your gums super sensitive.
Oh, really?
Yeah, and way more prone to inflammation.
I didn't know that.
That's why some women get what's called pregnancy gingivitis,
Makes sense.
even if they've never had gum problems before.
It's like your body's constantly throwing you curveballs.
It really is.
Okay, so we've talked about medications, hormones. Time to address the elephant in the room, or the cigarette, I guess.
Mm-hmm.
We all know smoking is awful for your lungs, but be honest, What's it doing to our gums?
All right, straight up smoking is probably the worst thing you can do to your gums.
Really? Worse than not brushing?
Yeah, I'd say so. And here's why: nicotine, which gets you hooked, it chokes off the blood flow everywhere, including your gums.
Your gums need blood flow.
Of course. They need that steady supply of oxygen and nutrients to stay healthy, to fight off infection.
Okay, yeah, that makes sense.
Smoking basically cuts them off at the knees, leaves them totally vulnerable.
So you're basically starving your gums of the very things they need to survive.
Exactly. And if that wasn't bad enough, smoking also weakens your immune system.
Oh no, double whammy.
Yeah, making it even harder for your body to fight off those infections.
Yeah.
It's like you're just inviting gum disease in.
Well, you've officially scared me off cigarettes for good.
Good. That's the goal.
So we've learned a lot today. Swollen gums, it's not always about skipping brushing and flossing. There's a lot of other factors.
Right. It's a lot of things to consider.
Could be an abscess, some sneaky gum disease, a side effect of our medication, hormones, or, as you put it, basically welcoming gum disease by smoking.
That's a good way to put it.
It's way more complex than I thought.
It is complex, and that's why seeing your dentist regularly is so important.
Yeah,
Think of them like detectives for your mouth,
I like it.
trained to spot all those little clues most people miss.
Early detection is key, right?
Absolutely. Catch it early, and you're way ahead of the game.
Speaking of early detection, you mentioned earlier that even just one swollen gum could be a sign of something more serious. So what should someone do if they see that? Should they freak out, call the dentist immediately, or just wait and see if it goes away on its own? So let's say I'm staring in the mirror, doing my morning routine, and I spot a little something extra on one of my gums. Time to panic.
I wouldn't say panic, but ignoring it. Not exactly a recipe for a healthy smile.
Okay, so what's the sweet spot then?
It's all about knowing the signs. If that swelling is sticking around, like more than a few days, or if you've got other things going on like pain, breath that could clear a room, a weird salty taste, those are your cues.
Gotcha. So a little swelling, no biggie, but add in some special effects, and it's time to get a professional opinion.
Exactly.
This is good stuff.
And you know what the best part is? You have a lot more control over this than you might realize.
Now that's what I like to hear. Give me the good news.
It all comes down to good oral hygiene. That's your secret weapon. We're talking brushing for a full 2 minutes, twice a day. None of that half-hearted stuff.
Okay.
And flossing, daily. Got to make it a habit like brushing. I know, you've heard it a million times.
It's true.
But are you really doing it consistently enough to actually make a difference?
Okay, you got me. I could be better about the flossing.
See, it's all about consistency.
You're preaching to the choir here.
And if you smoke, well, quitting is honestly the best thing you could do for your gums and your overall health for that matter.
You've definitely gotten that point across today.
Good, because it's important. Now, one more thing to consider. What you eat, it plays a bigger role than you might think.
Really?
It impacts your entire body, mouth included. So load up on those fruits and vegetables, stuff that's got calcium and vitamin C.
So it's like a healthy diet for your whole body is a healthy diet for your mouth, too.
Exactly. It's all connected.
This has been a serious eye-opener. I had no idea there was so much to it.
It's more than just brushing and flossing, that's for sure.
It's like you've given us this whole new way of thinking about our bodies, starting with our mouths.
Exactly. Those gums, they have stories to tell. Pay attention to the signs, don't ignore them, and remember, you've got the power to keep that smile healthy and bright.
I love that your gums have stories to tell. I think we just found the title for this deep dive.
I like it.
And on that note, a huge thank you to expert speaker for joining us and breaking it all down.
Always happy to be here.
And to you, dear listener, we hope this deep dive has inspired you to take charge of your oral health. Until next time, stay curious.